John Johnson is the vaccination advisor for Médecins Sans Frontières.
There's a lot of different factors, but there's a very simple main factor behind why there's a resurgence of measles in Europe, especially. It's low vaccination rates, and a lot of that happened during the COVID pandemic. There was a reduction in uptake of healthcare services and vaccination, and we saw a global drop in immunization rates around the world of about 2% during that time. And that 2% doesn't sound like a lot, but with a very contagious disease like measles, that drop in immunization coverage is enough that we're going to start seeing outbreaks.
And many of us will never have seen measles. I mean, what is it? What does it look like? What does it mean for the patient?
So measles is it's a respiratory pathology. You get it through the air, and the symptoms that you see are often in children. It's a disease we typically see in children. It's a rash, a fever, a cough, a runny nose, and then about 10 to 25% of children will go on to have severe symptoms, and they can have respiratory illness. They can have brain swelling. Measles is one of the main causes of blindness around the world. And then the mortality rate, the number of children with measles that will go on to die, is between 1 in 500, 1 in 1,000 children. So it's not just a benign disease, it can be quite a severe disease.
COVID, of course, around the world meant perhaps many communities were suspicious of vaccines, but your message on measles would be what?
Well, I think people don't realize that vaccines are extremely safe. When we talk about safety in medicine, we look at the benefit and the risk. When you're talking about a cancer drug, the benefit is maybe limited, and sometimes there's very high risks that go along with that. But you're treating, a very dangerous disease like cancer, and even if it has some bad side effects, we can accept if the benefit is better than the side effects. The problem when we talk about vaccines is we're not treating an existing disease, we're treating a future risk. And so people don't necessarily see that the risks are necessarily worth the benefits. The risks of vaccines are extremely, extremely low for this very reason, because we have a very high bar for safety with vaccines. And I think it's important that people understand that vaccines are really one of the most important public health interventions that's ever been developed, right up there with safe drinking water and improved hygiene.
So what can we do then, as parents, as schools, communities, what can we do to turn the tide on this?
Well, I think educating people is important, but I think also being able to have open conversations. What we've seen where I work is when people maybe are a bit hesitant about vaccines, and we've seen a lot of vaccine hesitancy as a result of the COVID-19 pandemic. In fact, the most important thing is not to try to convince anybody of anything, but really try to understand what their concerns are and be able to answer their questions. And I think as health professionals, and I think as political leaders, we need to be ready to take the time to have these conversations and tease out the misinformation from the facts.